Today we are debating a motion that speaks to the challenges facing rural and small-town Ontario as a result of the surgical backlog. And I want to say, as MPP for London West, I have seen those problems become even more acute when I look at the people who live in the small communities surrounding the urban centre of London, who not only can't get health care in their own communities, but they can't even get health care from the urban centre that they rely on. Speaker, when surgeries resumed in January, we heard from London Health Sciences Centre that there was a staggering backlog of more than 7,000 surgeries in our community, and this doesn't even include imaging and non-surgical procedures. And staff at LHSC predicted that the backlog was going to take 3 to 5 years to clear, and we all know that it is actually an underestimate of the actual size of the backlog because of all of the delayed screening that was happened during COVID, all of the undetected cancers that weren't caught by screening, and all of the people in serious pain whose pain has become so much worse because their surgeries have been delayed. But Dr. Adam Duclos from London Health Sciences Centre says that, in fact, it's his biggest fear is not the numbers, it's not the unsurmountable number of surgical procedures, it's having enough people to do the work. And that is what is so important about the motion that is before us today. It calls on the government to invest that $1.3 billion in new funding that the FAO has said is necessary to clear the backlog. It says the motion calls on the government to do the work that's required to develop a comprehensive health human resources plan in consultation with local communities, and most of all, it calls on this government to repeal Bill 124. And we have all heard from nurses in our communities, nurses who are burnt out, who feel completely disrespected by this government, who are leaving the profession for another career, who are retiring early, who are relocating out of this province to another jurisdiction that respects their skills and abilities. And I want to just read something that Julia, who's an RN in London West, wrote to me. She says, "I am fed up with this government's meaningless platitudes of appreciation for nurses." She also says, I am also sickened to watch the continual erosion of public health care by this government. Speaker, this is not new in London, the backlog of surgeries, and I remind this government, this Minister of Health, of the letter I wrote back in March 2020, and in fact the letter was sent on March 12th. I think it was the day that the WHO declared the COVID global pandemic. But I wrote to the Minister about the fact that our community was facing longer wait times for surgeries than anywhere else in the province, anywhere else for hip and knee, in some cases 3 times the provincial target. And we know from Statistics Canada, London has been recognized as the fastest growing city in Ontario. Our population grew by 10% over the last 5 years, but the number of fully funded, which means staffed, hospital beds in our community certainly did not. And I want to conclude with a shout out to the London Health Coalition that organized a media conference last week to sound the alarm on this government's, the proposal that they're considering to transfer more surgeries to private for-profit hospitals in Ontario. Privatization is not the answer. Privatization simply siphons off staff from the public system and will only make the problem worse. We need to proceed with the measures that are outlined in this motion if we are serious about dealing with the surgical backlog in this province and getting every Ontarian the health care that they deserve and should have access to. Thank you, Speaker.